Hello and welcome to Eisenhower Health. My name is Bridget Davila and I'm one of the infection preventionists here at Eisenhower. We will start with a video from the CDC on healthcare-associated infections.
On any given day, about 1 in 25 hospital patients have an infection caused by their medical care. Almost half of these patients are 65 or older. There are 5 places where patients are most likely to get infections: in the bloodstream, the urinary tract, the gut, and the 2 most common places are the site of surgery and the lungs. The germs most likely to cause healthcare-associated infections include C. difficile or deadly diarrhea, staph, including the drug-resistant type known as MRSA, a family of germs known as Enterobacteriaceae that includes CRE, the nightmare bacteria, Enterococcus, which can be resistant to an important antibiotic, vancomycin, and Pseudomonas, which can cause infections of the lungs and bloodstream. 1 in every 9 patients who gets an infection will die during their hospitalization. Over the last several years, great progress has been made in preventing some infections. For example, bloodstream infections in patients with central lines have been nearly cut in half in the last 5 years. But more work needs to be done. CDC's goal is to eliminate all healthcare-associated infections. We work 24/7 to save lives and protect people.
This next slide is just a snapshot of that video that you just watched. I know the video is a little bit outdated, but it just gives you a snapshot of about 99,000 people die each year in the United States due to healthcare-associated infections. That costs the healthcare system billions of dollars a year in fees. Medicare no longer pays for healthcare-associated infections to the hospitals. This is why it's important that we must reduce healthcare-associated infections within our hospital. And I'll give you some examples on how we can do that. These are some of the examples of MDROs: MRSA, CRE, VRE, ESBL, and C. diff. These are the ones that we mostly see in our hospital on a day-to-day basis. And these are your people who are at risk for an MDRO infection. Anyone with low immune systems, severe illness or disability or chronic illness, burns or people with open wounds, anyone with invasive medical equipment, so that's anything like a tracheostomy tube, implanted catheters, so central lines, and Foley catheters. Anyone with longer repeated hospital stays, and someone who does not finish all of their antibiotics. What do you think is the most important thing you can do to prevent HAIs? I hope you all said hand hygiene. This is the single most important thing you can do to save lives in our hospital and in our community, is to wash your hands. Eisenhower Health follows the CDC hand hygiene techniques, and this is when you should practice hand hygiene. Whenever hands are visibly dirty or contaminated, before having contact with patients, before putting on gloves, before inserting any invasive device, manipulating an invasive device, and you want to wash your hands after having contact with the patient's skin, having contact with bodily fluids or excretions, non-intact skin, wound dressings, or contaminated items, having contact with inanimate objects near a patient, and removing your gloves. 2 ways that you can effectively wash your hands in the hospital or in healthcare clinics is hand sanitizer, or the good old-fashioned way is soap and water. When you use the hand sanitizer, you want to rub the alcohol hand rub together until your hands are dry. No need to rinse it off or dry it with a paper towel. When you wash your hands with soap and water, you want to rub your hands together for 15 to 20 seconds, rinse your hands well, and you want to dry your hands with a paper towel or air dry, and then you use that paper towel to turn off the faucet. Fingernail policy. It is Eisenhower Health's policy that artificial nails or anything artificial on your nail is prohibited on healthcare workers who are engaged in direct, hands-on patient care or indirect care. So these are healthcare workers who work with sterile supplies, linen, any type of supplies that are going to go to patient care needs. Artificial nails are not allowed in our hospital, and this is because they can harbor bacteria within the artificial nail and your natural nail, especially after washing your hands, that creates moisture, and that's something that bacteria loves and can harbor within the nails, and we don't want that spreading while doing patient care or handling patient supplies within our hospital. This is what we'd like for your hands to look like, is the short, preferably clear nail polish instead of dark nail polish. Dark nail polish is hard to see dirt and grime underneath the your nail bed. So nail polish or light clear nail polish or light colored nail polish is preferred, so that this way you could see any type of dirt underneath your nail. Short and clean instead of long and fake fingernails. Standard precautions. So at Eisenhower Health, we treat as though everyone is considered infectious, and so we use standard precautions for everyone. And this includes hand hygiene, the use of personal protective equipment, proper cleaning and disinfecting of patient care, sharp safety, waste management, and linen management. We also use respiratory hygiene stations throughout our entrances and different areas of the hospital. Where you'll see mask, tissue, a sign that says to cover your cough and cough into your elbow, the use of hand sanitizers in our waiting rooms, and then isolation to rooms of actively coughing and sneezing. A little update on COVID. So we ask that every healthcare worker, if you are sick, please do not come to work. In EICNET, on a daily basis, when you are scheduled to come to work, you are to fill out this attestation with 2 questions and hit submit. If you have any of the following symptoms, any one of those following symptoms, you should not be at work. We'd like you to get tested for COVID. And if it's not COVID and you still are having symptoms, you should still stay home until those symptoms have resolved and you're either cleared by employee health to return to work, because you could have other symptomology or other infectious diseases other than COVID before returning to work. We'd like you to be clear of that. Clean environment. So environmental hygiene is also as important as hand hygiene. MDROs can persist in the environment despite routine cleaning practices. MDROs can remain for weeks without proper surface disinfection. These are a few examples of some of those pathogens that can live on hard surfaces. So these are things like the bedside table, the IV poles, any type of surface that the patient touches. These types of organisms can live on those surfaces for a very long time. So C. diff can live up to 2 years in the non-infectious state. If the environment was not clean with the appropriate disinfection or wasn't clean at all, and someone happens to not wash their hands and inadvertently, put their fingers in their mouth, they can now ingest those C. diff spores. And then once it gets to their gut, that's when C. diff will actually activate and come into the infectious form, and that's when someone can get sick. MRSA, 7 months, rotavirus up to 3 months that could live in hard surfaces, so on and so forth. You could see on the slide. So that's why it is very important that disinfecting your environment, the patient's environment, is as important as washing your hands. High-touch surfaces I covered as far as doorknobs, bed rails, telephones, light switches, bedside table, and even the curtains in the patient room are considered high-touch surfaces. And if those are not cleaned appropriately, the risk of contaminating your patients or transferring those pathogens to your patients puts them at greater risk of acquiring that MDRO. These are the 2 wipes that we mainly use in the hospital. The purple top is our Super Sanicloth. It takes 2 minutes to kill the pathogens listed on that container. and which means that the surface has to stay wet for 2 minutes in order to get that effective kill time. If your surface does not stay wet for 2 minutes and it dries less than 2 minutes, you did not kill anything on that surface that you are trying to wipe. So it's really important that you visibly see that surface stay wet for 2 minutes in order to get that effective kill time. The other one is our bleach wipe. That's a 3-minute kill time. We mainly use these for our C. diff patients because that's the only thing that will kill C. diff, and our rotavirus and norovirus. So these are our pathogens that cause diarrhea, and those are bleach is the only thing that will kill those type of pathogens, and 3 minutes is the dwell time or the contact time to kill those pathogens. So your surface will have to remain wet for those 3 minutes in order to kill those type of pathogens. A little alternative disinfecting wipes. So currently within our COVID pandemic this year, we've had to add new disinfecting wipes. So because of not being able to receive product into our healthcare system, our materials management have done a phenomenal job in trying to get us disinfecting wipes throughout the within the hospital. So you'll see this type of slide posted on ICNET, and you'll see the variety of these wipes on your units, and they all have a different type of contact time, and this is the time that you'll need to wait for pathogens to be killed, and these are all approved by the EPA to kill COVID, so they're all approved by us to be used in healthcare. So just know that we have currently, because due to the pandemic, a variety of different alternative wipes to use, and just be mindful of the type of wipe you're using. Read the label on the canister to know the correct disinfecting time to use. Our EVS team is critical, but everyone can pitch in as far as disinfecting patient care equipment. So before and after patient use, we ask physical therapists to disinfect their patient equipment, such as walkers, crutches, gait belts that they use to help ambulate patients. Transportation services should be disinfecting their wheelchairs and stretchers, anything that they use to transport patients. Our nurses, our aides, our techs should be wiping down Dynamaps, IV poles, commodes, blood pressure cuffs, and things like that that go from patient to patient. Those should be wiped down in between patient use. Admitting personnel, pins, clipboards, anything that's used between each patient use should be wiped down as well. We'll go over our transmission-based precautions and our isolation signs. When you see this sign posted outside the patient's door, this patient is actually in contact precautions, which means that you'll need to perform hand hygiene before you go into the room, put on gloves, and put on a gown. This patient is in contact isolation, which means that this type of organism is transferred by touch. Therefore, you would have to wear your gown and gloves before you go into that room. This type of sign, the patient is in contact enteric, which you would still have to wear your gown and gloves. It's a reminder to wash your hands with soap and water. This type of sign is a little different than the contact sign because we use this type of sign when a patient has those organisms that cause diarrhea, like C. diff, norovirus, and rotavirus. So it's a reminder to use the bleach in this type of room and to wash your hands with soap and water. This is more effective at getting rid of the spores on our hands. When we wash our hands, we'd like to wash those spores down the sink. It's more effective than the alcohol hand sanitizer. Our droplet isolation sign, all you'll need to do before you go into the room is hand hygiene and wearing your isolation regular surgical ear loop mask before you go into this room. And this type of patient is usually this type of isolation is usually used for someone who has influenza or meningitis. The next sign is our airborne isolation sign. This one, you'd have to be fit tested for an N95 mask. You'd want to wash your hands before you go into the room. You wear your N95 mask, and usually this type of isolation room would be for a patient who has a TB or a rule-out TB. Our newest sign this year due to the pandemic is our COVID combined isolation sign. So this type of sign, you're gonna wanna wear your N95 mask and your eye protection, which is either goggles or a face shield. When you go into this type of room, you'll see these on our COVID units. Just a reminder that PPE is not a fashion statement. You shouldn't wear your PPE throughout the hospital, with the caveat of we are in this pandemic, so everyone is wearing a mask. Everyone does wear face shield or eye protection throughout the hospital, so you will see those type of healthcare workers throughout the facility wearing their mask and face shields or eye protection. But things like your isolation gowns and your gloves shouldn't be throughout the hallways. This is actually something that the state will write us up for, and we'll have to do an action plan if they see us throughout the hallways touching elevator buttons and using our cell phones and things like that, wearing gloves when you're not using it in the immediate patient care area. Patient hygiene. So you gotta ask, as patient advocates, our nurses and CNAs, we need to ask, like, when was the last time our patients actually washed their hands? When's the last time they brushed their teeth? Because they can be their own source of contamination spreading. Their bioburden goes up, by second, by the minute, by the day. And if they're not doing their oral hygiene every day, taking their baths or offering their CHG bath on a daily basis, washing their hands before they eat their meals every day, it's just as important that they maintain their personal hygiene within the hospital, as well as we do when we're taking care of them. We'll talk a little bit about waste disposal. And the thing that I want to say here is that it's really important where we place our trash, because we have to pay to get rid of our trash here at Eisenhower. And it travels to different states, and we pay per pound. And so just be mindful that regular trash, we put it in the white regular trash cans, which is this white trash can you see. The red trash is the one that we kind of worry about a little bit more, and we don't want to see regular trash in the red biohazard bins. So things like your lunch or newspaper or paper towels or gloves, things that are not soiled with blood or contaminated, do not go into the red biohazard container. That costs more for us to get rid of, so we want to be mindful that we don't put regular trash in the biohazard trash can. Sharps waste, anything that has rigid corners, edges, something that can actually puncture through a plastic bag needs to go into the sharps container. So syringes, needles, scissors, Kelly lamps, forceps, broken glass, ampules, all would go into this sharps container. Pharmaceutical waste, so no sharps or broken glass goes into this container. These all have a purple top on it. This is for pharmaceutical waste. This is for wasted PO meds. Chemotherapy waste, so we do have a chemotherapy or a oncology unit. Any items contaminated with preparation or administration of chemotherapy will go into these yellow containers. And then battery waste. So we do have a bucket on every unit. So batteries from like tele boxes, cell phones, any type of batteries that we have on the units that are dead go into this battery bucket. They don't go in regular trash, and they're disposed of appropriately. I will leave you with this last video. This gives you a really good picture of how organisms are spread throughout the hospital when you do not perform hand hygiene. If you have any questions, Mike and I are available 24/7. We're on call. You can call us. You can find us on email, on IkeNet. We have cell phones. You can leave us a message, and we'd be happy to answer any questions that you have. I just want to let you know that you guys are our eyes and ears out there. So if you see that we can do something better in infection prevention, please let us know, because that's the only way that we'll know that we can do a better job for you in helping you protect our patients and keeping you safe while doing so. Thank you, and I hope you enjoy working here at Eisenhower Health.